Have you ever wondered why some people who don't take care of their teeth don't get cavities? Sometimes I have a patient, and when I tell them they have a cavity, they point to their brother or sister sitting in the chair next to them and exclaim, he or she doesn't ever brush their teeth, but I get all the cavities. Life isn't fair. Well, there are reasons for this. One of them is that plaque that is being brushed off partially consists of little microscopic bugs called bacteria. Some bacteria cause cavities, but many others don't. Interestingly enough, there is at least one type of bacteria that may help prevent cavities. It gets tricky because we likely don't know all the bacteria that cause cavities. This is because there are at least hundreds of different bacteria and other microorganisms that inhabit the oral cavity. Unfortunately, most of these are difficult to grow outside the mouth on, let's say, a petri dish. This means that scientists can't study them and figure out what they eat, what they produce, or what they do. How do we know there are a lot of bacteria that live in the mouth? It's from something called PCR, or polymerase chain reaction. PCR is basically a laboratory procedure that isolates small amounts of different DNA. It's from their DNA that we know there are so many. If you're going to get cavities, you have to have the bacteria in the mouth that cause them. What are some of the bacteria that are known to promote cavities? The main one is called streptococcus mutans. Yep, the same family of bacteria that cause strep throat, along with a lot of other infections. Another one is Lactobacilli. Let's focus on S. mutans, an abbreviation for streptococcus mutans. How does S. mutans cause cavities? This is the simplified explanation. They eat the sugars that you eat. From these sugars, they produce acid. The acid dissolves the first layer of the tooth called the enamel. Once it has dissolved the tooth through the first layer and it gets to the second layer, a hole is created that is technically called a cavitated lesion, or commonly referred to as a cavity. Now, there is a whole lot more fascinating things going on to create this hole, but this is just the gist of it. By brushing and flossing, you are mechanically removing both the bacteria and the food they eat from the surface of the tooth. The less bacteria, the less food for them to eat equals less cavities overall. Why are there some people who don't brush and floss, but yet don't seem to get cavities? They may just not have enough S. mutans and other cavity-promoting bacteria in their mouth to make a difference. Or maybe they have enough cavity-inhibiting bacteria to counteract the S. mutans. Should they continue to ignore oral hygiene? Probably not. As mentioned, there are a lot of bacteria in the mouth that don't cause cavities. Some of these do cause inflammation of both the gums, called gingivitis, and the bone, called periodontitis. These can lead to periodontal disease, bone loss around your teeth, and eventual tooth loosening or loss. One can see the inflamed gum tissue in this photo. Consider yourself lucky if you don't have cavities, but still take good care of your teeth. You will likely be glad you did. Besides that, who wants dirty teeth or bad breath? Wouldn't you rather look like this? I'm Dr. Brian, and now you know.